All right, we're back with another episode. So Brenda Schmidt, from the CEO of Solera, thanks for joining us. I really appreciate it.
Thanks, Brian.
Yeah, and so you had a presentation today. So is this easier than the presentation, I hope? Just sitting down and having a conversation?
Yeah.
Okay,
yeah,
good.
This is good.
So I want to kick off. You brand yourself as a social entrepreneur, and I want to dig into that definition a little bit. What was the driver behind branding yourself that way, and what does it actually mean to be a social?
Yeah, I think a social entrepreneur, it's beyond just the mission of the company. Every company has a mission that can be applied to helping, especially in healthcare, helping people improve their health. For Solera, it's a really deliberate and intentional opportunity to impact not only individual people's health, but community health. So how is what we're doing actually making a social impact? And so we actually have to do every year, both on behalf of our clients who are health plans, do an actual corporate responsibility survey, and then we have a social impact investor who expects us to gauge and actually be graded on the social impact that we make through our business model.
So the entire model of the company is set up around that structure.
Yeah, if you think about what Solera does, we're trying to take a public health model and privatize it. So we recognize that healthcare happens where, in doctors' offices and hospitals, but health happens where people live, work, play, pray, and shop. And these evidence-based interventions have been delivered for a really long time, but they've been completely disconnected from healthcare and in most instances grant funded. So we saw the opportunity to organize these highly fragmented community providers into a network and then pay them through claims, just like any other healthcare provider who's improving the health of individuals, creating a sustainable revenue model for them. So there's this huge impact not only to create a sustainable wage for individuals delivering those interventions, but more broadly those community benefit organizations who haven't been connected into healthcare to receive those payments.
I'm guessing the entry point to that is that patients want to operate differently. Would you say that's accurate? And you kind of have to fit it into the model, but you have to keep the patients at the front of it.
It's interesting that you call them patients. We don't think about them as patients.
Really?
We think about them as people. They're consumers.
Okay.
And you're exactly right. If you think about what we do, and underlying what we do is behavior change. And behavior change is really highly personal. And there is no one size fits all to getting and staying healthy. And so what we saw the opportunity is to organize these highly fragmented providers into a network that helped them be healthy. And so we took a very different tactic in terms of how we're actually going to approach, engage, and talk to consumers that was completely flip the model of what we would traditionally think of as helping patients improve their health.
And when you say providers, is that doctors' offices?
No, and in our world, we call our network partners providers. They just happen to be community organizations and then the digital apps.
Okay.
And, healthcare runs on choice and value and networks. And no one had ever networked all of the community organizations, and that's everything from YMCAs to Weight Watchers to grocery, retail, pharmacy, areas on aging. And then you can see here at the health conference, there are thousands of digital apps. And the paradigm of picking one and expecting it to meet the needs of really diverse populations and drive great outcomes is a flawed methodology.
Yeah. And on the flip side, being an entrepreneur and thinking you're going to be the one app that rules all, I think that's how I hear a lot of entrepreneurs I talk to think about their company. But I just can't see that model playing out the way they think it is, because there's so, like to what you say, there's so many apps out there. You really want the patient to be able to choose what's right for them.
Exactly.
Yeah.
I mean, we act like Match.com. The Match CEO is actually an independent director on our board. And when you think about that, the opportunity to drive great outcomes is identifying each individual's unique goals, needs, and preferences and matching them with the digital app or community provider that best meets those. And inherently, you're going to raise all boats because we're sending qualified leads to the digital apps, and they're going to have better outcomes. And so if you think about what we are, we're almost a digital therapeutic formulary, and our clients, our health plans, expect us to compress this market based on cost and quality. So the digital apps should just be thrilled that we're sending them the best patients to fit their program so they drive great outcomes.
Absolutely. So let's go back to when you started the company. What was the mindset? What were the drivers? just where were you at, and what led to the founding of the company?
Well, before Solera, I bootstrapped another company for about 10 years. And it was really the collective experience of that company that made me realize that the market needed a technology platform that could truly connect the evidence-based programs and services happening outside the clinical setting into healthcare. And those two worlds never had collided or were integrated before. So I shut that down and went out and pitched the idea behind Solera. And at the time, a lot of the venture capital companies had been looking at all of the early point solutions in digital therapeutics. And they had a hard time, again, like you said, like picking their winning horse. Like, who do I bet on? And when we showed up and said, we've networked them, it just made sense. And so we closed our Series A at the end of 2015, and then I've just been growing incredibly quickly.
So did you recognize that these digital apps were on the rise? Like, was that part of the thought process at the time?
Actually, the thought process at the time was organizing community organizations. We didn't have a radar back in 2012 and 13 that there was going to be this incredible influx of digital therapeutics. The regulation was hadn't really caught up with the technology, and there were some really early companies out there, but there was no way to pay for them. So the market had to evolve. But early on, we launched the company specifically around the diabetes prevention program, not because we wanted to be a diabetes prevention program company, but huge market, so 1 in 3 adults. The Centers for Disease Control had invested almost $200 million in creating the network, and we had a line of sight based on the early evidence from the YMCA that health plans were going to pay for this. So it was the perfect ecosystem to prove the business model. We could organize highly fragmented stuff, we could contract with health plans, get it paid for, and engage consumers. And since that time, we haven't solved a healthcare problem, we've solved a supply chain problem.
Sure.
So when the digital folks just started to explode, it was a no-brainer to include them in the network.
Yeah, and I think diabetes is a perfect example to demonstrate the power of digital therapeutics. If you learn about the disease, it's managing a bunch of data points, and I think that disease in particular is one that fits the model of digital therapeutics can be highly successful.
Yeah, I mean, and now there's a lot of evidence around the opportunity to actually reverse diabetes, and that's lifestyle medicine. And again, it goes back to that intensive behavioral counseling. People may want to do that through a ketogenic diet or a whole food diet or medication, so really trying to understand how that individual wants to better manage their condition and what that means to them and where they want to start. Because the literature will show if you just sleep better and reduce your stress, you'll have a lower A1C. You spend time in nature, you'll have a lower A1C. So what does the person want to do to impact that? We run straight to expensive drugs when there are a lot of other interventions that have been proven that can make a huge clinical impact that aren't pharmaceutical.
Yep. You keep mentioning evidence. So is that a consideration when you decide what technologies to enable or link up through your platform?
Absolutely. So everything that Solera has in our network is paid for through medical claims. So it has to have an evidence base that a health plan is validated that it actually is going to deliver the outcome that it is intended to deliver. So when a community organization or a digital app wants to enter our network, the very first thing we say is, are you aligned with what you do? Is it aligned with the evidence? And can I get paid for through a claim? So things on the U.S. Preventative Services Task Force, ADA guidelines. So we look at the evidence-based guidelines, and they're published, and we only include those interventions that align with that evidence, so that's how we could get paid through the medical claim.
I think that's such an important point to underscore, because you go and search Amazon and look for diet books, and you're going to get a gamut of some things that are considered evidence-based, some things that aren't, and it ultimately just confuses the consumer when you have these things that are branded as healthcare but aren't truly.
There are 318,000 obesity-related digital apps, and you go to the health app store, or the app store. You can go to App Annie and find out how many users and with the number of stars they have, which sometimes is unrelated to the fact that can actually drive outcomes. So when we think about ourselves as like the TurboTax or LegalZoom for health, so you can see your doctor if you want, or you can come into this ecosystem and be matched to a provider, a network partner of Solera's, and you are guaranteed that is going to improve your health. because we've vetted that network. And I think that curation, which means there are winners and losers, and that we actually tell you how likely you are to meet your goal based on what we're matching you with, is a very different experience than sort of hunting and gathering, which is going on today.
And that drives, as a consumer, trying to figure out diet, lifestyle, trying to make sense of all the noise out there. I mean, it's just near impossible. You almost have to test and iterate.
Exactly.
And so I think that's great. So are there any other disease states that really jump out that you've moved the needle on or enabled moving the needle on as a company?
Yeah, I think definitely diabetes prevention, obesity more generally, diabetes management and that piece. And then what we're just starting to embark on now is looking for other highly fragmented, I'll call them chaotic markets that do have an evidence base and multiple delivery intervention modalities that we can match things into. And I think what's exciting for us going into 2021 is this conversation around social determinants of health. Because if you think about those interventions like medically tailored meals or falls prevention, social connectedness, economic security, transportation, they have a documented impact on the cost and quality of care. Our model allows those things to be integrated into benefit and insurance design and paid for, which is very different than I think a lot of the conversations around those things that are happening today. And
being an entrepreneur, I imagine you keep a pulse on what's happening from a digital healthcare startup. And one of the things that I've noticed at the conference is the technology's ready, the product's ready. It's been tested, but it's hard to integrate into the healthcare ecosystem. Just trying to find a spot from a business standpoint. Your company helps bridge that gap in a lot of ways, right?
I mean, we can help our clients follow the innovation curve as new digital technologies enter the market. We can seamlessly plug them into our network and our millions of clients or members very seamlessly without them having to burn through a bunch of cash trying to get a health plan contract. And even in a scenario where a payer would really love to contract with a provider, a digital app provider, it's super expensive for the health plan. And it's also very costly for the digital therapeutic. I think it's at the minimum for a health plan contract is probably 9 months.
Wow.
And typically more like 18 to 24 months. That's a long time to wait to get to $1 from a payer.
Yes. Yeah. And
it's a long time.
You have to really be in it for the long haul.
Yeah.
So what's been the response? I guess, who do you consider your customer? Because you support a wide variety of people.
We've created a consumer choice network. Our client is always a health plan today. Okay. They sell Solera as an innovation into their self-funded employers. So they just code us as preventative services typically, even though we're doing chronic disease management and remission. They sell us to their self-funded employers. So we think about that group as our client. They pay us. Our network our technology platform is our product, but our network is our product as well. But ultimately, we get paid when consumers engage and they ultimately hit clinical outcomes. So it's a marketplace.
Okay. That's such a unique business model, and I'm sure it's fun because you get to kind of touch with a bunch of different players. What's the folks that help enable bringing these apps to life? What's your interactions like when you talk about their health plans and trying to figure out how your company can interact with the plans? Are they very open to this new concept? Because it's way different than anything else.
The digital apps?
Yeah.
I think the incumbents that have been around for a while think about us as a competitor because they don't want us to disintermediate them when they may already have a direct relationship with a payer. For the new market entrants, we are a huge benefit to them to be able to plug in, and they don't have to go out and hire a big sales force. They don't need a sales force. They don't need revenue cycle management or reporting or member engagement or sales, because we can actually have quite a bit of economies of scale and efficiency by taking over all of those back office functions, which frankly helps them be more profitable. So the new market entrants are really excited about what we're doing, and they're driving absolutely phenomenal outcomes, but they may not be some of the big brands that have been established in the market.
Makes sense. And on just getting the plans connected with some of these new apps, are they open to this, and do they want as many new technologies as possible, or is there some resistance there?
You know, they want the best providers they can have in the network. So when I say provider, again, it's a digital app or community organization, but they don't want the most. So they expect us to We establish all the performance metrics for every therapeutic area,
Mhm.
and then we monitor the performance of each of those digital apps to those performance metrics. And if there's a digital app that cannot meet those performance metrics, then they are put on a performance improvement plan. And if they can't improve, ultimately removed from the network. And
Wow.
so why would I enroll anyone in a program that isn't highly likely to achieve the outcome? And so our health plan clients expect us to compress the market. And there's a huge amount of price variability among the digital therapeutics, in some instances an order of magnitude. So all things being equal, based on matching someone into the program or service that's best for them, I'm going to match them to the highest quality, lowest cost digital app. Isn't that what we should do for
Right.
value-based care? And so I think that is going to allow us to actually align incentives across the entire industry.
That makes perfect sense. Another way of asking that same question, is there resistance to change or resistance to new technology that you see across the board? I'm guessing.
No, not really. I mean,
Okay.
I think there's some payers that say, hey, I have done a pilot, or I'm aware of these certain vendors. I'm just going to send them over to you because
Mhm.
we reduce a lot of friction and administrative burden from the payer and employer to manage this whole network on their behalf, contracting and all of
Sure.
the back end. But most of them just say, you guys go figure out the best digital apps and network providers out there for the problem that I'm trying to solve, and they trust us to do that. And so if we can find new novel technologies that are going to help drive the outcomes that are strategically important to the payer, they're super happy about
Win-win,
that.
right?
So I don't see that resistance in
Okay.
the marketplace.
That's really good to hear. I mean, it's
Yeah.
refreshing because I think there's always a perception that doctors are unwilling or maybe just don't have the information to prescribe or recommend some of these newer technologies just from the fact that they don't know about them. Do you find that more and more these type of technologies are coming to the forefront and are part of the conversation when you go and see your
They are.
physician?
They are. I mean, people are recognizing the opportunity for digital therapeutics
Mhm.
to improve cost and quality of care. I think there's a general recognition. I think as a nascent market, sometimes it's hard to figure out how to actually get that credibility and trust of the digital therapeutics by the medical community. And I'm completely against doing a biopharma model for digital therapeutics. Because in a pharmaceutical model, when you do a randomized controlled trial on a drug, what you release to the market is the drug you did the randomized controlled trial. When I've seen the landscape of digital therapeutics and some of the new technologies, they may do a beautifully designed randomized controlled trial, but they know they're going to publish the outcomes. And so they put a lot more typically human interaction at a higher cost. They have great outcomes, and then they publish those outcomes, and they're out there for forever. But the digital therapeutic that they put in the market inherently is going to evolve over time, and in most instances look nothing like what they did the randomized controlled trial. So I don't think we should have this FDA approval biopharma model to digital therapeutics. It just doesn't apply.
It doesn't make sense.
It doesn't make sense. So we look at it and say, we're the real world translation to see who's actually driving outcomes, and let that real world translation drive who we're paying for.
Yeah, and it's not sustainable. I don't think to
think
do the biopharma model,
what
because
it does is drive up costs and slows innovation.
it slows it down tremendously.
Yeah.
Because if you have to get approvals just like you would for every step of the product, that's not how apps work.
I know.
I mean,
and then you've got the pharmaceutical companies saying, oh my gosh, my pharmaceutical is taking so long. How can I make a business out of digital therapeutics? So it is interesting to see those worlds kind of come together.
Yeah, it's really interesting. So I wanted to ask a question about new entrants versus established players in the healthcare industry. And I think you mentioned that there's kind of both happening. Do you see one has an advantage over the other? Or I guess what are some of the differences?
I think the established market players have brand recognition. They were early to be, as early adopters. They had good trials. They had brand recognition, and they're sort of held up as this gold standard, but not based on any comparative data with perhaps some new market entrants that also have comparable or better outcomes in the market that maybe aren't as well known.
Okay, that makes sense. You mentioned trust. I imagine that's a huge consideration in everything you do, because you have, if you're the marketplace and you're enabling these new technologies or bringing them to light, the last thing you want to do is recommend something that doesn't work, to your point. So how do you maintain that trust, and how do you validate that you have that trust with all the different parties that you support?
Yeah, I think the first part about trust with the health plans is transparency. So we were 100% transparent on the outcomes of our network. They're not our programs and services, but sometimes that's a hard conversation when we pull the data and we've got lower performing partners in our network. So I think that that transparency drives trust with our health plan clients, that we'll have an open conversation around who's in the network. I think with consumers, it really is around their ability to be in the driver's seat for having what I call a self-directed care plan. They're choosing what they want to do, and we're offering choice and we're offering value. Then they're picking it. But I think more importantly, we're asking them, hey, you've been using this app for 30 days. How do you like it? And if they rate it a 1, 2, or 3, we're going to say, do you want to change your goal or do you want to change your program? So from a consumer perspective, they're not stuck. They can go and seamlessly switch among these programs with no cost to them. And so they feel confident that they don't have to get it right the first time. And we're there to take care of them through that journey as their health and social service needs change.
Yeah, and the fact that you're a market, I think that's you have a benefit that you're a marketplace. You're not trying to push anything. You're
right.
Not,
I mean, if I'm just a single point solution and you are not successful in my app, you're going to drop out. We have the opportunity to say that may not have been the best fit for you. Here's other things that may be better for you. And so that sustained engagement is really high because we have alternatives.
Yep. So back when you founded the company, I'm guessing the landscape looked quite a bit different than it does now. I commend your foresight, knowing that it's going to be madness and that digital therapeutics are going to blow up. Was it a difficult trade-off to make, designing your platform to be so flexible? Because I think that's probably the best part about Solera from my perspective, is that you can plug in with anything.
Yeah.
Was that something consciously designed and incorporated early on?
Well, now I say we're the syringe, and you can put anything you want in the syringe. So I appreciate that you recognize that platform is really flexible. But when we first started, it wasn't. It was really to build a technology platform that was proving the business model. And we only really did one thing, and it was pretty inflexible. And we had to redo our entire technology platform to introduce that flexibility.
Oh, come on. You can say you had magical foresight.
No, I had no magical foresight. But I wouldn't have invested in this broader platform 4 years ago without proving that people were actually going to pay us for what we built in a completely new business model. I mean, even to this day, I'm not even really sure what to call what we built. People always want a reference account. They're like, are you like a PBM, or are you like MultiPlan? Are you like Castlight? Like, they want to find a reference for us, and there isn't one. We've created this new business model and market, and it's confusing.
Yeah.
It's confusing.
Did you design the product or figure out your fit and business model first? Like, were they both designed early on, or at least thought out together?
Yeah, it was always our intent to be a technology platform to match members into a really broad ecosystem of community and digital. That was always the longer term vision. I think that vision is continuing to evolve in how we may be a consumer company.
Sure.
You know, I mentioned around the LegalZoom or TurboTax. Like, you can see your accountant if you want, or you can have TurboTax and be pretty confident you're going to get your taxes right.
Yep.
Well, you can go to your doctor if you're sick enough, but I look at us as democratizing healthcare by allowing people to come into the platform, create a care plan for themselves, understand if they're clinically eligible for what they want, if their health plan is going to pay for what they want, and manage it themselves without necessarily having to have a doctor, but integrated with the physician if they want it. It's a really different model, and that's where we're headed.
Sure. And talk about your approach to partnerships, because I know obviously you have kind of inherent partnerships in the business model you've set up, but I know you've had some stronger partnerships that you've broadcasted recently.
We have great partnerships. Fitbit's a great partner. So early on, we did an experiment. We were giving everyone a digital scale because we wanted non-self-reported weights. And then we had one of our partners actually say, hey, I've been giving out Fitbits and I've seen an increase in outcomes. And we're like, that's interesting. So we did a pilot with one of our health plans, and we gave half of the people a Fitbit and half of the people we didn't. And we actually evaluated that data, and it was fascinating. We published a white paper with Fitbit a year or so ago, and we actually saw more people hitting their outcome metrics, greater clinical outcomes, and higher engagement with the people that we provided the Fitbit. And it was interesting because that actually increased with age. The older you were, the more striking the outcomes. And so I didn't want to give Medicare beneficiaries Fitbits, but the data was just so striking. Now we give everyone a Fitbit. So
that
we
is
have a
so
strong
surprising.
Partnership. I thought we'd give them the Fitbit and they go, oh, thank you very much, and drop out of the program. But it really was striking. And, you know, whether that will always be our strategy or we will more go with a bring your own device, but but the brand was really strong and drew consumers in. And then they were like, oh, now I also get, Weight Watchers and a Fitbit, or I get this other digital app and a Fitbit. And so it really, I think, helped us create brand awareness.
Do you find there's a ton of instances like that where you expect one thing and find out something?
Yes.
Isn't it crazy?
Hopefully I find that out every day. Yeah. What you think, another one of those instances was, you always think about the more questions I ask someone, the more drop off they're going to have. So if I ask 5 questions, I'll be super sticky. And if I have 20, then everyone's going to drop out before they ever get to the end of the survey. And we did a lot of user acceptance testing because we're matching. We're actually look like a match.com. And I learned 2 things: that if we offer someone something of value, they will answer a lot of questions. So look at match.com. You get a love quotient, right? That's like, what's that? And so what they told us was, if you're only asking us 5 or 7 questions, again, back to trust, I don't trust you that you're going to make the best match for me. And so it was really fascinating that the value proposition to consumers and what was driving them to actually tell you a lot of information about themselves, if they're confident that you're going to give them back something of value.
I imagine that's got to be one of the most fun parts about your job, is just that unknown about the future, and you're always discovering and always learning.
I'm a lifelong learner, and I just love to challenge those, I think, perceptions that we all have around people. And we had a big debate in Washington a few weeks ago, and half the room said people do not want to be engaged in their health, and the other half of the room says, yes, they really do. But we're fundamentally trying to figure out whether people actually want to be engaged in their health or not. So I think there's a lot of learnings around applying consumer behavior into healthcare.
Who doesn't want to be engaged with their health?
I know.
That doesn't seem...
what I say is people are engaged in their health.
Yeah.
They're just not engaged in the health that's connected to the existing healthcare ecosystem.
Yeah, that's probably it. Yeah. It has. I hope it's it.
Yeah, I hope so too.
Yep.
I hope so too.
So I want to kind of wrap up the talk about Solera and then move to some career questions, just generally. Sure. So what do you think? What does the future look like for Solera? Where are you going, and what excites you about the future from a company standpoint?
Yeah, I think what excites me about the future is always thinking about us as sort of the digital front door into a broad set of programs and services, much more than even our existing program providers, where consumers can come in, reduce the friction, and make it really simple to do whatever they want to do. So for us to be integrated into things like decision support, match with the doctor, symptom checker, pay my bill, pharmacy savings. And so as opposed to what's your health goal to improve your health, it becomes, what do you want to do today? And really having the opportunity to have a much closer consumer relationship. And I think about it as the Stitch Fix model, where I'm going to know so much about you and create these archetypes based on data points that I can really start to recommend things for you that are going to be super valuable to you before I have to ask you a lot of questions.
That would be awesome.
I know.
Please do that. Because it's like, okay,
I'm a consumer. I want that.
Yeah, I know. So, I want to lose weight. I want to eat better. Just the general
I want it
thing.
to be simple. We don't make healthcare very simple.
It's probably one of the most complex things, and also one of the most important things. It's kind of a dichotomy that doesn't really add up for me. Yeah. So transition career-wise. So you've been an entrepreneur for some time now.
Since 2005.
So is that was that something you always sought out? And the question I want to follow up with is, do you think entrepreneurship is for everyone in healthcare in particular?
No.
Okay.
No, I think you have to have it in your blood and almost have this thing that you're just passionate about. And I didn't start off as an entrepreneur. I was a science person. I have an undergrad in microbiology and a master's in immunology, and then actually went to work for Baxter Healthcare. So I worked for a Fortune 100 healthcare company for 15 years. And I became an intrapreneur. So I was responsible for Latin America for about 6 years, and I had about a $92 million P&L. And I got that feeling of what it was like to be out there. Certainly I had a huge safety net, but they sent me to the Center for Creative Leadership. And I said, you know what? I don't want to work for Baxter. Great company, but I don't want to work there for the next 25 years. But what it did was give me the foundation around quality and compliance, like where when I spun out and became an entrepreneur, so I negotiated getting laid off. I had 18 months of severance, which I don't think happens anymore. That was my capital. I knew nothing about venture capital. To be able to have that, I always even say today, I want the foundation of a Fortune 100 company with the scrappiness of a startup. I think today, if you just come in and you build a digital app, and a technology, it's harder to understand that foundation of quality and compliance and
probably
build
probably evidence too,
and data and there's some foundational things that have to happen there, and that's just different than the actual product that you may have developed.
Yeah, and you're seeing this Silicon Valley model start to creep into healthcare a lot more, and I think that's probably the biggest realization they've had is that you can't just try things. There's people's lives at stake, and so you can't. The test and iterate approach just doesn't work. But finding that balance between speed and quality and maintaining that, and it's so critical and so hard and nuanced to find that exact balance. And I'm guessing
it's hard to have a test and learn culture in healthcare, and yet it's imperative to be able to move the needle.
Yeah, absolutely. So, anything else from a healthcare entrepreneur compared to just a generic entrepreneur in some other sector? Is there anything else that stands out that's uniquely difficult?
I think because healthcare is so complex, I always say, don't build an app and go out and look for a problem to solve. There are so many problems to solve in healthcare. Go find a problem, and there's a lot, and then build a solution to that problem. Sure. And then go find the individual who has P&L responsibility for the problem that your solution can solve. And that cuts out a ton of time around trying to get to product market fit, because I think that's what's so important in healthcare, and busting through all of the noise is that product market fit, and then selling to someone who actually has financial responsibility for that problem.
Yep.
That would be my advice. And I see a lot of digital apps, digital therapeutics technologies that are a technology looking for a problem.
Yeah, with no footing and hard to get off the ground. Yep. So I want to transition, being a woman, female entrepreneur. I know that's something you advocate for quite a bit. I guess my take, I've done the podcast for 2 years now, and from a diversity and inclusion standpoint, my goal has been get the brightest people with the best stories, and diversity is followed. And I'm wondering how you think about being a female entrepreneur, because on one hand, there's clearly the statistics are the statistics, and there's just not as many as there probably should be. But on the flip side, I think I don't want to generalize every female entrepreneur and hype them up, because what I want to hype up is their companies, the problems they're solving. So how do you find, I guess, what do you say from a female entrepreneur standpoint on how people should...
I don't like the label. I just want to be a great entrepreneur, and I don't want there to be any distinction between me as a female entrepreneur and a male entrepreneur. I think the qualities are the same, and those qualities may be less prevalent in women than men in terms of how, I'm really competitive, and I'm super resilient, and I've been willing to sacrifice a lot for this passion that I have around trying to build this business. But if somebody calls me and says, hey, I'm looking for a great female XYZ, I will pass. I'm not going to be the token female on a panel or the token, and so I want to be recognized for what I'm building and the accomplishments that I have as an entrepreneur, and that gets me, super excited in creating the legacy here and the business model that we've created. But I'm really sensitive to being held up as this sort of female entrepreneur, as opposed to just an entrepreneur that's doing awesome things. I completely understand that. There is, I think, some truth, though. I want to highlight that you can do it, because I bet there's I imagine there's a lot of male potential entrepreneurs that are nervous or don't think they can do it. I guess you would say, though, that highlighting female entrepreneurs, not to highlight them as females, but to highlight them as entrepreneurs, you can
is
do
important.
this. And I would also say, try it. And we can always, was my thought process when I decided to go out and really take a risk and start a company. I had to go, I can always get a job. Yeah. But I don't want to be at the end of my career and look back and say, I never actually had the guts to try.
Yep.
And so maybe it's not the right thing, but I would say I do think that those of us who are successful in this field show that you can be successful. You can raise money. You can hire great team members. Yep. You can, get clients. And so I would say highlighting successful female entrepreneurs as role models is phenomenal.
Yep. And probably back to your original point, highlighting just entrepreneurs in general that are doing it, especially in healthcare where it's so hard. I mean, just talking through your story and a bunch of other stories, it's not easy. It's not for the faint of heart.
Sometimes I say that being a female entrepreneur is helpful because no one's paying attention. I mean,
really?
Sometimes I think that, like, you don't have a lot of credibility early on, and you're not in those kind of circles maybe of serial entrepreneurs. And I used to say early on that, we're gobbling up market share and no one's paying attention. Mm-hmm. Now they are, but early on I felt that somehow what we were doing was under the radar.
Do you feel there's any barriers as a female entrepreneur that maybe males don't face?
Well, I think, this is going off on a tangent, sometimes it's really hard for men to know how to relate to women. So you're in a network. No, seriously. I mean, maybe that's a really general statement, but you're going into a networking event, right?
Yeah,
and there's all these groups of men, and they might be talking about sports or golf or whatever, and you walk up and it's just they're not sure how to talk to you. You know, they're
Gotcha.
not sure that it's just not as natural a conversation as it would be as if another guy just walked up.
Okay.
And so I think that those social network, social norms are difficult sometimes in informal business relationships.
Gotcha.
That makes it a little harder for women to kind of break in.
Okay, that's fair. Yeah, that makes sense. Yeah, it's good. I want to make sure. Is there anything that as just a male within the industry that we can do to help support diversity and inclusion? And my take is always just be nice to people and talk to people as they're people. But I'm wondering if there's anything else you can think the industry as a whole can do to help encourage more entrepreneurship.
Yeah, it's interesting. We have guiding principles at work, and early on we had one that said, treat people the way you want to be treated.
Mm-hmm.
And we completely changed it, and we said, treat people the way they want to be treated. And I think that that's an underlying principle in the business that we have, and matching people to what they want, but also really understanding what people want and
Mm-hmm.
what's important to them. And that attitude necessarily improves inclusion and diversity because it fosters greater understanding.
Yeah, absolutely.
Yeah.
So what, I guess, what's the driving force for Brenda as an entrepreneur? Is it growing the business? Is it moving the needle and trying to help unhealthy folks get healthy? I guess, where do you...
I think that as Solera, we have a shot of making a difference in healthcare. I do. I think we've got a shot at true transformation. And so I have this burning desire that it can't happen fast enough to get this thing going. And honestly, it's about a legacy. It's about, I want to be able to scale this thing enough and prove that we can actually make a difference. It's not about the money.
That's great.
And I think that's confusing to people sometimes.
Yeah, I can imagine so. But I think connecting to your purpose is the best thing you can do for your job. I came into healthcare and didn't have a whole lot of background, and then I connected it to some of my personal life, and it just shot me out of a cannon. It changes the equation.
It's all about purpose. It gets
Yeah.
you up every day. It helps you blast through the times when it's really, really hard if you focus on that purpose. And and that's what's driving you. If it's about, I'm going to build this thing and have a great exit, that wouldn't get me excited.
Yeah, right. Well, the last question I've been asking all the guests, I think it's clear coming to the conference and seeing this convergence between healthcare and technology. It's an exciting time to be a part of the industry. So talk about what excites you about either the present day or the future. Like what do you hope for, and what are you looking forward to?
Yeah, I think like everyone, we're all waiting for the day for true interoperability and truly helping people holistically manage their health by having an integrated record of all of their social, genomic, health record, personal preferences. If we can package all of that to really help understand how we can move the needle at a personal level, I think this concept of personalization is really exciting, and we're probably 5 years away.
5 years. Okay.
I think so.
That's positive. 5 years is a short
I'm in a
short
hurry.
time in healthcare.
I'm in a hurry.
Yeah. Well, great. Any closing thoughts, or maybe anything? We covered a whole bunch, and you have a great perspective. And thanks for
this
sharing
is
your
great,
story.
Brian. Thank you for the opportunity.
All right. Well, best luck. If anyone wants to get in touch with Solera or you, what's the best?
Yeah, reach out to me on LinkedIn. So it's Brenda Schmidt, Solera. You'll find me on LinkedIn. Feel free to shoot me an email, brenda.schmidt, SCHMIDT, @soleranetwork.com.
Okay. Well, thanks so much. Enjoy the rest of the conference, and thanks again for taking the time.
Thanks, Brian.